Hey guys, this is Kristen, and this is part 2 of muscle weakness in Ehlers Danlos patients. So I want to start this video with the reminder that I am not a doctor. So if you have any muscle weakness, please make sure that you go see a doctor that has a medical license. If you feel that you might be having a stroke, please make sure to call 911 or your local emergency number to make sure that you get immediate help, because that is a medical emergency. And so with that, the reason that I want to talk further about muscle weakness in periodic paralysis is because I want to elaborate on some of the kind of like complicated factors that I've seen specifically as it relates to functional neurological disorder and periodic paralysis diagnoses. And I invite any like healthcare professionals out there that are experts on these topics to please feel free to comment. I really want this to be an open discussion. I think Dr. John Stone, who is a leading expert in FND, is totally on point when he says that communication is really key in functional neurological disorder and in the diagnosis process. And so I'm not a perfect communicator by any means. I have blind spots. There's still a lot that I don't know. And the reason that I'm making these videos is to bring to light the confusion, I think, about the diagnosis of functional neurological disorder, and like where as a patient I get tripped up in understanding the condition, and to also bring in like what I've seen when doing research like between functional neurological disorder and periodic paralysis, because I've seen a lot of similarities. And I think it's especially important for EDS patients to know about this, because they're finding that these conditions happen in both pretty frequently, and they both look really similar in presentation a lot of the time. So that's why I want to get into this. I think an accurate diagnosis is really important. Obviously, for treatment reasons, functional neurological disorder is treated very differently from periodic paralysis. Periodic paralysis also, it's really important to know if you have it for the sake of like medical procedures and anything involving anesthesia. There's like specific protocol for people that deal with that. They want to make sure that they're monitoring your potassium levels, like if you're going into surgery. There's certain anesthesia that can be dangerous to people with periodic paralysis. And there's also just like kind of normal medical procedures like colonoscopies that involve, what do you call that? Like the procedures that you do before the actual procedure, like where you drink the like laxative and everything, that can actually have a major impact on periodic paralysis patients and recovery from those kind of procedures. So I think like another great reason to get an accurate diagnosis, to be concerned about an accurate diagnosis, is also for family planning. At least that was a big factor for me. Periodic paralysis is a genetic condition. There's a genetic mutation that happens to the genes related to the potassium ion channels, if I'm getting that right. And so that can be passed on to your kids if you decide to have kids. So that's good to know going into it. Or at least I think it is. Maybe some people just don't want to know, and that's okay too. But I think it's also good to know like as far as planning to become pregnant, I've heard like varying stories about pregnancy making things better or worse, like for periodic paralysis patients, or even like things becoming worse, after pregnancy. So just good things to be aware of, if you decide to become pregnant. So some of the interesting things that I've found, I think in the functional neurological groups, support groups that I'm in, there is a lot of skepticism, and I identify with that very strongly. I am still a skeptic about functional neurological disorder, and I have days where I'm like, this is not a thing, and then I have days where I'm like, okay, this like does make sense. It is an actual thing, and I'm in that place right now. So, but there's a lot of discussion in the support groups about misdiagnosis, and there are fairly frequently people who leave the support groups because they found they have been misdiagnosed with functional neurological disorder, and they have been found to literally have like a brain tumor or basal ganglia encephalitis, or whatever it is. And I think there's like a lot of misunderstanding about functional neurological disorder because of the history that it has, based in what was thought to be conversion disorder, which it is not. It's been found to be not a psychological condition. In fact, I think something like only 13% of patients diagnosed with functional neurological disorder are helped by psychotherapy. And you can find out, there's like a list on I think it's the FND Hope or the neurosymptoms.org website, which are both really great resources for functional neurological disorder. There is, pages about other conditions that can be misdiagnosed as FND. So that is a possibility that functional neurological disorder can be misdiagnosed. There's also other conditions that look like things like multiple sclerosis, but they can actually be functional neurological disorder. So it's complicated, and a lot of the basis for functional neurological disorder, the basis of the diagnostic criteria, I'll go ahead and like read off the diagnostic criteria for functional neurological disorder. And this is based on the DSM-5 list. The first criteria for a diagnosis of functional neurological disorder is one or more symptoms that affect body movement or your senses. This is the second criteria, symptoms can't be explained by a neurological or other medical condition or another mental health disorder. And 3, symptoms cause significant distress or problems in social, work, or other areas, or they're significant enough that medical evaluation is recommended. So to me, that diagnostic criteria is problematic, and I think this is being addressed. I think that experts in functional neurological disorder are expressing the need for positive signs to be the diagnostic criteria for functional neurological disorder. So that meaning that the diagnosis needs to be based on what functional neurological disorder is, versus what it's not. And so I think that's good. I think that's heading in the right direction from the patient perspective. To me as a patient, right now, as the diagnostic criteria are, I think that it's problematic. The second criteria, symptoms can't be explained by a neurological or other medical condition or another mental health disorder. I think especially when you get into rare disease like periodic paralysis, where the specialists are so advanced in their area. A lot of doctors don't know about those conditions, and there are so many rare diseases out there. If you go onto the NORD website, I'll put a link in the description, but there are a lot of rare diseases out there, and some of them are related to muscle weakness. So you've got like mitochondrial diseases, channelopathies, I've lost the word for that one, but you got things like other more common, I shouldn't say more common, but other things that can be related to Ehlers Danlos syndrome, like craniocervical instability or CSF leaks. So there's a lot of different things that can cause muscle weakness that, unless a doctor's not specialized in a particular area, that they're just not going to be trained in that. And that's not to speak against them, it's just not their area. So I think that's where I have concern as a patient. And I think another thing as well is that even with the positive signs that doctors are looking at to diagnose functional neurological disorder, which I think is great that we're looking for positive signs. There's even confusion about that among medical professionals. And so like, for example, I was reading a medical journal article about functional gait abnormalities in functional neurological disorder and how to identify whether a gait is a functional gait or whether it's a, I don't know how to word this, non-functional gait that's related to another condition like dystonia or multiple sclerosis or Parkinson's disease. And what I gathered from that article is that that those gaits can be identified by incongruencies. And I took incongruencies to mean like inconsistencies, and I don't know if that's a correct interpretation. If you're a pro in the field and you understand that, please comment. But I do wonder, because I actually reached out to the author, one of the authors of this article, and I think they did a fantastic job of addressing the complexities of diagnosis. But I reached out to him, and I was so appreciative of his honesty. He said, I asked him specifically, on the basis of incongruency, like, are you able to distinguish a functional abnormal gait from like an abnormal gait due to a channelopathy like periodic paralysis, where the gait might be more or less severe depending on the severity of the attack, where the episodes are episodic, so it might start suddenly or end suddenly, and where the gait might look what I take to mean incongruent, but it's actually due to a genetic mutation causing these channelopathies. And so one of the authors of this article wrote back saying that he couldn't speak to that area because he doesn't have channelopathy patients, which in one hand, I was super grateful that he was being so honest. On the other hand, it was concerning to me, because if this is one of the authors writing an article on functional neurological disorder, and if he doesn't know about channelopathies and can't speak to that, then how many other doctors also don't know about channelopathies and who do know about functional neurological disorder, and they might mistake the two, you know what I'm saying? So I wonder if there could be these large gaps in knowledge among physicians and, how we might bridge those gaps. And I think raising awareness is certainly one. I think being self-aware as patients and presenting our symptoms and communicating them as clearly as we can help. And I think these rare disease organizations can certainly help. But those are just kind of the thoughts that go through my head and about why these diagnoses can be so complex. So that's kind of my thoughts there. Let's see. So one of the other concerns that I had about functional neurological disorder diagnoses and periodic paralysis is that there's a lot of similarities in some of the symptoms. So, for example, brain fog and difficulty concentrating, in my understanding, can be present in both. Sensory sensitivity to light, sound, touch can be present in both. Muscle weakness and paralysis can be in both. Sudden changes in mood, like anxiety, fear, irritability, or getting tearful, like before an attack, is very common in both. Difficulty speaking, bowel and bladder symptoms, stress can impact both. In my understanding for periodic paralysis, anytime you have a fight or flight response where your adrenaline is going, that has an effect on potassium levels and how they're transferred in the body. That's a really crude explanation, which an expert can explain way better than I just did, but that's kind of my high level understanding of that. But yeah, adrenaline inducing situations can impact periodic paralysis. And also, this is just from personal experience. This is not something I've seen in the literature. This is just something I was told by, I think, like just reasoning physicians, which I don't think it's off base for them to think this. But asthma medication reactions, which I talked a little bit about in the previous video, I've heard that asthma medications can trigger the fight or flight response, which can trigger FND symptoms or periodic paralysis. So there's a lot of similarities there. So I was really surprised by all the similarities, especially when I was first learning about functional neurological disorder. I had been much more entrenched in periodic paralysis, and getting to know people that had periodic paralysis much longer than I learned about functional neurological disorder. So it was really surprising to learn all that, but also like really eye-opening too. And like our brains are really amazing, complex things. They can do some pretty amazing things, some pretty bizarre things at times. Let's see what else has been causing confusion for me. I think this is just like a frustrating part for patients, but symptoms not presenting during a doctor's appointment can be really frustrating and discouraging because like the doctors can't see what's happening. And I think it's great that we have like video now. I think it's really difficult as a patient when you're experiencing muscle weakness to really capture like more severe episodes, or at least I know it has been for me, because I can't really hold the phone to be able to film them. And I work from home a lot, and a lot of the time that's when I'm experiencing attacks. And so I don't really have anybody there that can film it for me, but I think it is great when people are around to be able to capture those moments so that doctors can visually see what's happening. I think that's helpful. And I think just the other, like just the nature of both conditions being, like, we're still learning so much about both conditions. I think it's going to take a lot of time to really clarify the mechanisms and the causes behind these two, but it's really encouraging to see the research that is going on behind them. And yeah, I think it's going to be helpful for us as patients going forward. So let's see. I think if you are finding that you are looking into FND and periodic paralysis, some things that are helpful to know as a patient, and I highly encourage looking at periodicparalysisassociation.org. They have a YouTube channel as well, and getting as much research in as you possibly can to inform yourself before going into doctor's appointments, that can be really helpful, I have found. Just to be able to, like, for me, I found it helpful to, like, not only be immersed in the language and to kind of, like, have an understanding of what doctors are discussing, but also that context has helped me be able to, like, ask questions that I wouldn't necessarily have thought of going into an appointment. So I think that's incredibly helpful. But I think some of the things to look out for that a lot of doctors don't understand about periodic paralysis is that one, potassium levels, like in blood work, can be in the normal range for periodic paralysis patients, even for those who are genetically diagnosed. So a doctor cannot rule out periodic paralysis because of normal potassium levels in blood work. Another thing to keep in mind is that all of the genetic mutations for periodic paralysis have not been discovered yet. So, for example, when I was on the beginning of my periodic paralysis journey, I had genetic testing for the INVITE periodic paralysis panel, which I will include a link. I think they still offer it for free, but I'll include a link where you can find that. A doctor does need to order that genetic testing, but it doesn't have to be like a neurologist. You can have your GP request it. So that's a really great resource, but that can be really helpful if it does come back positive, because that gives you some reassurance that your symptoms are connected with periodic paralysis. For patients like me, where the genetic testing comes back negative, that doesn't necessarily rule out periodic paralysis because there are genetic mutations that we just don't know yet. Another thing is that negative or normal CMAP lung exercise test cannot also rule out periodic paralysis. I have heard in these support groups where people who are later genetically diagnosed with periodic paralysis actually, like, didn't come up positive on any kind of EMG testing until like their third try of the same test. As I mentioned in the previous video, there's a specific protocol, the Fournier protocol, that needs to be followed, like, very strictly for that to be an accurate test. but that's just something to be aware of as well. Another thing is that there can be heart complications from periodic paralysis. Regular cardiac monitoring is recommended, and but sometimes those arrhythmias or any kind of abnormal heart rhythms won't come up until like there's a severe attack, or like somebody's taken a medication that they're sensitive to, or they're having a severe heart event, cardiac event. That's not all of them. Some people do have their arrhythmias show up when they're not having an active attack. But that's just something to be aware of too. For example, there's somebody in our support group, I think, who has Anderson-Tawil syndrome, and she didn't know until she literally went into cardiac arrest. And that was her first cardiac symptom. So like a normal EEG doesn't necessarily rule out periodic paralysis, in my understanding. So those, I think, are the like big things. I've heard it said from experts that that can, like, certain testing or negative test results can lower the level of confidence in a periodic paralysis diagnosis, but it doesn't necessarily rule it out. I've also read about other conditions that can cause muscle weakness that it might be helpful to know about. For example, I've mentioned some of these: craniocervical instability, especially for Ehlers Danlos patients, malabsorption. So if you're not absorbing certain vitamins and minerals, that can impact muscle weakness. Mitochondrial disease. There's conditions like MELAS, MELAS, M-E-L-A-S, that can cause stroke-like symptoms. There's also, I think they recently found actually that there's a mitochondrial disease that causes periodic paralysis. So I thought that was really interesting. Cerebrospinal fluid leaks, CSF leaks, are something to be aware of that can cause muscle weakness. Myasthenia gravis, hemiplegic migraine, metabolic myopathies, and other channelopathies. So there are other genetic mutations that can cause channelopathies, I think, in the like sodium ion channels, the calcium ion channels, that can also cause similar symptoms to periodic paralysis and can cause muscle weakness. So I will put those names in the description in case you want to look them up for yourself and do some personal research. Another one that I heard was, and I confirmed this with a physician that specializes in POTS. I was diagnosed with POTS, but I heard in one of the support groups that anecdotally some patients with POTS have been found to have potassium-sensitive POTS, meaning that their POTS symptoms fluctuate based on their potassium levels. And the specialist that I saw did confirm that that was anecdotally found, so it's not something to, rest your hat on, but just something that's interesting to consider. And I believe calcium levels and magnesium levels, like even outside of channelopathies like periodic paralysis, can cause issues with muscle weakness too if you don't have enough salt, if you don't have enough potassium. So there's a lot of different things. That's why it's so important to see a doctor and get things checked out. It could be like kidney issues, so definitely something that is worth talking to a doctor about if you're experiencing muscle weakness. I'm going to include a video of maybe 2, we'll see, of an episode where I'm experiencing moderate weakness. And this is when I did not have somebody else to film I didn't have somebody else there to prop up the phone or hold the phone or anything. So it's pretty, what do you call it? Pretty basic, but I just want to say that nobody was harmed in the making of that video. I'm holding a knife because I was making lunch and I was cutting up lettuce. It was a very dull knife, but I do not recommend using a large knife while you have muscle weakness. Not a good idea. Just use me as the non-example in this case. But yeah, just so you can kind of get an idea of what my attacks look like. But I think that is all that I've got for now. If you have any thoughts, if you've experienced muscle weakness, if you have heard of other conditions common in Ehlers Danlos patients that can cause muscle weakness. I've heard even that MCAS, which is pretty, mast cell activation syndrome, which is pretty common in Ehlers Danlos patients, can cause muscle weakness, and that's something I'm interested in looking into. If you know any good resources, please let me know in the comments. If you are a professional in the field and can bring clarity to anything discussed here, or can share any great resources, that would be awesome. So I look forward to your thoughts. All right, thanks and bye.